And then the last conference we want to highlight on today's session is the HEAL conference. So to some of you, you might be thinking, oh, HEAL, I've never even heard of this. So we have with us not only a colleague, but a dear friend of mine, Cindy Broadus, and she is the Executive Director of the National Alliance of Wound Care and Ostomy, and she's going to talk to us about this new kid on the block that actually has a lot of history steeped in the wound care marketplace, and just talk to us about this conference, how it came about. And so we want to highlight Cindy. Good morning, darling. How you doing?
Good morning. Thanks for having me.
Yes, it's fantastic. So HEAL had its inaugural conference this past year, and I was able to help you with that, but it's kind of a spinoff. So I don't want to, it's new, but not so new. So talk to us about how HEAL came to be, the ideology there, and kind of how this conference came to be.
Many of you are familiar with WOW, Wild on Wounds, and I was affiliated with Wild on Wounds as well as NAWCO for over 18 years. So when they decided that they were going to kind of get out of the market, we were like kind of just sitting back. We didn't know if we wanted to do anything or not, but we had so much interaction at the booth. People coming up and saying, where are we going to go? What are we going to do? Now what? Now what? And we made that decision. We had some previous discussions, and we made the decision right then and there that we were going to go ahead and move ahead with it. So we put it together. We put out a survey. We asked our clinicians, what do you want? What do you want to see in a conference? How long do you want it to be? Where do you want it to be? And we sent that survey out, and within 12 hours, we had almost 600 responses. So we took into consideration what they said, and we built this conference around these survey results. So it wasn't what I wanted or what others wanted, it's what they wanted. Because if you're going to get them there and you want them to have a place to call home, then you have to make it comfortable for them. So when we came up with HEAL, we looked and said, okay, is that going to work? Can we do it? And we knew what we wanted to do. We wanted to do hands-on education, advancement, and leadership. So we do a multitude of tracks as well. And one of the things that we found is that immediately upon opening our registration, that our hands-on sold out. They registered out. They were full. We had waiting lists. We had one that was 98 for a waiting list.
Yeah.
So I'm like, okay, well, this isn't going to work. We have so many people that want hands-on. So we were able to be flexible, and we brought in 10 more. We actually scheduled 10 more hands-on sessions, opened up 500 more seats during the time that we had so that we could accommodate, the people that were clamoring to say, I want in there, I want in there, I want in there. So we wanted to be different. We didn't want to just be lecture. We didn't want to be just, didactic. We wanted it to be immersive. And so we had at any given time, most of the time, 4 to 5 tracks running and 2 or 3 of them hands-on. And we did repeats of the hands-on because, of course, with hands-on and with what you're doing, we had negative pressure wound therapy, we had maggot debridement, we had conservative sharps. Dressings, we had an escape room. They loved all this and being able, we had some people that wanted to sign up for every single one, and we had some that signed up for the same one twice. So, that's one of the biggest draws we found was the hands-on component. And so that's kind of what our kind of drive is that we want them to be able to experience that hands-on, to take those learning tools back and then be able to use them at the bedside immediately. So that's kind of, we developed HEAL all around what those survey results were.
Mm-hmm. No, I think that's great because you reached out, and I can remember being at WOW for, better than a decade. And that was a core group. And one of the things that I want to just myth bust for a minute, because I always get that and you're like, oh yeah, wow, HEAL, that's that nurse conference. And I'm like, well, actually, no, it's really not. And so what kind of people attend HEAL?
Well, if you're familiar with NAWCO, that since its inception in 2002, we've always certified PTs, OTs, PMs, all across the board, licensed clinicians. So there's never been, any kind of set, rule of thumb that we only do this particular type of clinician or that particular type of clinician. It's the same way with this conference. We had, we thought, okay, first year, right? We're going to set it kind of, we're going to be conservative here. We're going to think maybe 400 to 500 attendees. We topped out at 634 total attendees. We had representation because we looked at this from all 50 states in Vietnam. We had clinical care, we have acute hospitals, we have long-term care, staff education, we had administration, and we had registered nurses, nurse practitioners, APNs, LPNs, podiatrists, physician assistants, therapists. We had everybody across the board. So it's not just a nursing conference. It is for all those clinicians who want to learn more about wound care, deserve to learn more about wound care, and have those other opportunities to do so.
So I'm sure you have some